We're joined now by Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, good morning to you, sir.
Good morning. 250,000
new cases a day. January already on track to be the deadliest month so far in this pandemic. President-elect Joe Biden last night calling the vaccine rollout a dismal failure. Dr. Fauci, do you share that assessment? And I know you're still advising the incoming president. What's the one thing that President-elect Biden could do in the first few days in office to try and improve the situation?
Well, there are a lot of things that could be done. I think one of the things that President-elect Biden has said and will be saying is that there'll be a greater degree of coordination, interaction, support on the part of the federal government interacting with the states. You don't want the federal government to take all the responsibility of doing this. You don't want the states to be left on their own. You've got to have a good degree of interaction. And I think that's what we're going to see more of, where states will have both help with regard to resources, but also more of a general coordinated plan about how to do this. I believe it'll be that, but other things that the president-elect will be announcing sometime soon.
We expect to hear from the president-elect this afternoon on some of this.
Exactly.
Dr. Fauci, the report we just heard there, 1/3 of the available doses in this country have been put in people's arms. How can that be?
Well, obviously we have to do better than that. There are multiple aspects of getting a vaccine program going, from the developing of the vaccine to the allocation, to the transportation, to the distribution, and finally getting it into someone's arms. You've got to have a good flow, and you've got to be able to expeditiously get it into people's arms once it gets to the place that has been distributed to. Unfortunately, that has not worked as smoothly as possible. There are a number of reasons for that. No excuses, but for example, it was started off in a big program. Whenever you start off, you're going to have some bumps in the road, some potholes. That goes without saying. It was started off in the middle of the holiday season between Christmas and New Year's, which always makes things complicated. But the other thing that I believe is now being corrected is that in an attempt to rigidly stay with the prioritization of 1A, 1B, for example, the first group would be for people who are healthcare providers, as well as those in healthcare situations such as nursing homes and the people who take care of them. Then people over 75 and people with essential jobs. The difficulty is there was a bit of rigidity in not going from one to the other. So as we open things up now, and I don't mean necessarily completely opening up the floodgates, but when you add a degree of flexibility that try not to get any doses that are just sitting there in the freezer or sitting there in a refrigerator getting ready to go. If you have a dose, give it, and don't be so rigid as to those early designations. So the CDC never meant to be rigidly adhering to that. And in fact, they came out yesterday and the day before saying quite clearly, we didn't mean it to be a rigid adherence, be more flexible.
Dr. Fauci, while I have you, I do want to ask you about this new study overseas, a study of British healthcare workers, and it found that folks with antibodies, according to the study, folks with antibodies could still carry and spread the virus. How worried should we be about our friends and family members who've already had COVID-19?
Well, one of the things that we don't have enough information about, and we have to be humble and modest enough to really recognize and admit that, we do not know the duration of the durability of protection from yourself to get reinfected, as well as spreading to others. We've got to be able to, and we are doing studies to answer those kinds of questions.
You still optimistic that we can get 100 million doses in 100 days?
I really do think so. I mean, we've discussed this with the Biden team, and we think it's quite feasible that we can do that. Right now, even now, we've gone from 500,000 a day to 750,000 a day. I believe strongly that it's doable. And if we do it, stay on target to get the overwhelming majority of the country vaccinated. I have used that determination. I believe it's close to accurate, if not accurate. We have no way of knowing at this point that if we get about 70% to 85% of the people in the country vaccinated, we likely will get to that umbrella of herd immunity that you'll start to see a serious turnaround of infections so people can feel. And I think it is possible after several months of doing this that we can start to approaching some form of normality. But it's really going to be dependent on the uptake of vaccines, which is the reason why we continually reach out to people to say, please, when vaccine becomes available, get vaccinated, because we really want the overwhelming majority of the country to be vaccinated.
Dr. Anthony Fauci on this Friday morning. Dr. Fauci, thanks as always, sir.
Good to be with you. Thank you for having me.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.